So we will be talking about the population and explosion and birth control. So you know what is population explosion? The rapid growth of population of particular species. Okay, so when we are talking about the humans, so humans population increased since the end of World War II. Okay, so what was the population in 1900? In 1900, it was world population was 2 billion. Okay, clear. But by the end of 2000, it rocketed to 6 billion, and by 2011 it was around 7.2 billion. You must remember these things. Why I'm writing this? Because it is written in our NCERT. Okay, so they can ask from these numbers. So uh, when it is a world population, but when we talk about the India, it was 350 million in 1950 at the time of independence. By the end of 1990 or 2000, 350 million. So during, yeah, 1950 it was 350 million, or 2000 it reached the 1 billion, and 2011 it crossed the 1.2 billion. So rocketing population. What is the reason for population growth? Why population is increasing so much? The reason is when the death rate declines, the population increases. Okay, so whenever a community or the species not dying at the quicker rate than the growing rate, okay, the population will increase. So rapid decline in the death rate result in the population growth. Rapid decline in the maternal mortality rate. What is maternal mortality rate? Mother death rate. Okay, so maternal mortality rate also declined, the infant mortality rate also declined, life expectancy increases due to good medical facilities and all. So and the thing, when these things were increasing, also the number of people in the reproductive age also increased. So when the number of reproductive people increases, the population growth will also increase. So these are the causes of population growth. So how will you control the population explosion? So number one, very simple process is just promote the families to have small families. Okay, do not have larger families, and promote to use contraceptive method that inhibit the formation of zygote or implantation or release of ovum. Raise the age level, legal age level of female and male, 18 years for the female and 21 years for the male. In Rajasthan there occurs the balika vadhu, we must have heard, the child marriage, then the child marriage act was passed. It is basically mental torture for the both parents and the child also, because marrying a girl in the 6 to 7 or 8 year is not at all good. Okay, she is not mentally, socially and physically fit for reproduction. um, Incentivize couples with smaller families, those having the smaller families, give them some bonus or something that they use, or other thing that is a good thing, we can have this bonus and we should have a small family also, so we can use this. So when we were talking about the contraceptive, what contraceptive are those things or methods that inhibit pregnancy overall, that. Okay, beta, that inhibit pregnancy. So the ideal contraceptive, that is the most important. I think that you will be having a question from this year. Okay, so must pay attention. What is, because first point is should be easy to use. Every person who is using must feel comfortable when using it. Okay, because we are talking in English because we are educated, we might know the use and we might read that and understand this, but the layman who do not know the science or technology behind the contraceptive, how he will use that contraceptive. It must be very easy to use. And the second thing is, should be easily available. It should be available at every medical store or even the shops which it gives this, so every person who want to use this can reach out. Second thing is that they are using the contraceptive, but if it is ineffective, that is no use. So should be very effective. And the other thing is, should not have side effect. है ना? If a contraceptive, or should have least side effect. है ना? Because many of the pills that the female take have some side effect, like maladi, mala, and they may cause irregular menstrual, they may cause mood swings, they may cause breast cancer and all sort of cancer things. Okay, so for this Saheli has been invented. We will discuss it later. Okay, beta. So should not have, or they the contraceptive should have minimum effect. That is very good. Should be reversible. Okay, if a person is using some contraceptive, like whatever it is using, and we will discuss it later. So if the some person has taken a pill, to prevent the pregnancy, so it must have done something to prevent pregnancy. Might the ovulation have been stopped? Okay, or uterus have been altered, matlab ke implantation will not occur. Okay, so if this thing have happened, so this should not remain constant after taking pill, should be reversible. The person should be able to get pregnant after using contraceptive, but that doesn't mean that after, even immediate after contraceptive, but it does not affect with the pregnancy of that person. If the pregnant, if the person want to get pregnant in future, if a family, they are planning for the family, that pregnancy should that contraceptive should not interfere with that, should be reversible. Okay, the last one of the most important point I feel is this, that it should not interfere with sexual drive, the desire, or the act of individual. Okay, so the ideal contraceptive are these. Clear? So what are the method of contraception? Like natural traditional method that is being used by our ancestors, that they were using before the advancement in the science field, and barrier methods. uh, these are not natural, artificial methods: IUDs, intrauterine devices, OCPs, oral contraceptive pills, injectables, implants, surgical methods. So these methods we are going to discuss today. Okay. So what are the natural method? Okay, basically it is natural. No artificial thing will be involved in this. Number is periodic abstinence. Periodic. Oh, there are some days which are said to be what? Infertile days during the life of female. So if someone, or if they coitus or intercourse during these days, the chances of being pregnant are very less. There is a method known as periodic abstinence, in which the coitus or intercourse is avoided during the fertile days, and they are from 10 to 17. Okay, because there is high chance of ovulation, है ना? So when there is chance of ovulation, so there will be possibility of fertilization. So even this is not 100% successful. Withdrawal or coitus interruptus, withdrawal of penis from the female reproductive tract before ejaculation, है ना? So if the ejaculation is performed outside, then there is also a less chance of, not 100%. Okay, there is also less chance of fertilization. Okay, whenever the coitus happens, this semen is released continuously and also contains the sperm, and then the sperm can reach the fallopian tube. What exactly is lactation and amenorrhea? Lactation is the breastfeeding. Lactation is related with the breastfeeding. So in amenorrhea means when there is no menstrual cycle. When the menstrual cycle is not occurring, that is very fine because no ova is getting formed. No ova is getting formed, so there is no chance of fertilization. So lactational amenorrhea is a 6-month period after delivery when no menstruation occur, but intense lactation occur. So during this period, when the coitus is done or the intercourse is done, the chances of getting pregnant is also almost negligible. Okay, out of these three method, among one of the safest method, yeah, highest safety of these among these is of lactational amenorrhea. Now the barrier method. Barrier is nothing. They are creating barrier between sperm and ovum. Okay, they are physically prevented from meeting with the help of barriers. Okay, like by using condoms, है ना? So the sperm is not allowed to meet the ovum. Similarly, yeah, this is more important to you. Okay, that could be asked in NEET. Remember this. There are diaphragms, cervical caps, vaults. These are inserted into the female cervix during coitus to prevent the entry of sperm through the cervix. Along with these, some cream that kill the sperm known as spermicidal cream. So that can kill the cream. Some jellies, forms that are used with this barrier to increase the efficiency of these methods. Okay, what this contain? No xylol. So, and one of the most beneficial thing about the barrier method is protect. So it is giving the contraception, but is also protect the individual from STDs, है ना, sexually transmitted disease. And that are easily available. Another thing, so if they have been wear on, so they can be easily disposed. Okay. What are these diaphragm, cervical caps, valves? They are made up of rubber. Okay, so what they are doing, they are nothing but preventing the entry of sperm to the fallopian tube. They are just a barrier for the sperm. Clear? And the most interesting thing, they are usable. Now the intrauterine device. Okay, so what are the intrauterine devices? So you can easily understand these devices by understanding this word intra, in between, uterus. Okay, when there are some devices which is inserted into the uterus by the specialized doctor or the expert nurse through the vagina, these are known as intrauterine device. Okay, so they perform various things. They basically they inhibit the pregnancy. How? There are three kinds of IUDs. Number one, non-medicated, that does not contain the medication at all. Okay. Second is copper releasing, that will be releasing copper. Once inserted, it will be releasing copper like copper T, copper 7, multi-load 375 and all. Hormone releasing IODs, that will be releasing hormone that is not good for the pregnancy. Okay, so this is the non-medicated IODs known as Lipis loop. You might so whenever look if this is inserted into the this kind of shape into the female body, it will retard the sperm motility. Number second thing is it increase the phagocytosis of sperm. Talk about the copper releasing. There are some IODs when inserted into the patient body, they release copper ions, and these copper ions are very helpful in suppressing the motility. They also retard the fertilizing capacity of the sperm. They are the example that you need to learn about, that is copper T, copper 7, multi-load. You might get a match the following type of things. Most of the time it is asked against that sort of question, and match the following, which is hormonal, which is non-medicated, which is copper releasing. So multi-load 375. Last among these is the hormonal IODs, which release hormone. They make uterus unsuitable for implantation. If the fertilization have occurred by chance, they will not be able to implant. Uh, Examples are LNG20 and progesterone. I think one of the most important point is the failure rate of these IODs is very low. Contraceptive that are orally taken, okay, like pills. So these are the pills consist of progesterone or combination of progesterone or estrogen. Most of the common female oral pills are Mala and Mala D. They are taken daily. That is very important. And the failure rate is also very less. Uh, the thing is, the daily oral pills started preferably within the first 5 days of menstrual cycle. So it will inhibit ovulation. It will also inhibit implantation. Uh, And the one of most the important pill is Saheli. Saheli is weekly oral pill, and it does not contain any steroid. Okay, developed by scientists at CDRI. CDRI is Central Drug Research Institute at Lucknow. Okay, so it has the few side effect and high contraceptive value, but the failure rate is a bit higher than the Maladi and Malayan. Okay, and daily consist of centromin or ormelafexin. Okay, so this is anti-estrogenic. DMPA injection. Uh, this is injection. These are called shots given after every 12 weeks. Effective for long duration. So it consists of medroxyprogesterone acetate. Sorry, and it is known as Depo Prevora. सुनाई होगा. So implant and Norplant are these subcutaneous injection. These are given basically they are tube-like or matchstick-like injections given to the female under the arm, and they release slowly. They release hormone progesterone. Okay, and this hormone, when there is high level of hormone, that is progesterone, it will act as a inhibit the release of gonadotrophin. So when there is no GnRH or LH or FSH is released, so follicle will not be stimulated, so ovulation will be absent. Okay, so this is very good. Long year, it is for approx 5-year prevention of or 5-year contraception. Now we'll talk about the emergency contraceptive pills. When the coitus happens and the coitus is unprotected, and there need to be a prevention, they need to take a prevention. So they take emergency contraceptive pills like I-pill, unwanted 72. Okay, and along with this, IUDs can also be as an emergency contraception. Surgical method, basically these are permanent method. Blocking the transport of gametes. So there are two methods. Basically, they are terminal method that they cannot be reversed. And once they have been performed, the surgery has been done. The chances of reversible is very, very, very poor because they are very fine tubules that need to be rejoined. Once they are cut, they are done. Male sterilization is known as vasectomy. Vasectomy arises from vasa difference. In this case, the vasa difference arising from the epididymis is cut and tied to the scrotum or scrotal wall. Okay. In this case, the transport of sperm outside the body is prohibited. Similar the surgical method is for the female, and that is known as tubectomy. In tubectomy, what happened? A small portion of the fallopian tube is tied and cut. है ना? Basically, first it is cut and removed, and it can be tied to the abdomen or vagina. Okay, so these are the most effective method, but the reversibility is very poor. Now, these other method is medical termination of pregnancy. Important. Okay, termination of pregnancy before completion of full term intentionally or voluntary is called MTP. And this kind of abortion, when you are willingly do it, is known as induced abortion. Clear? So MTP has a very significant role in decreasing the population, although it was not meant for that purpose, because population controlled was by using the contraceptive. This is not the contraceptive. See, this is the killing of fetus. The government of India, that is very important. The government of India legalized the MTP in 1971. Okay, with some strict provision to prevent its misuse. And in the 2017, an act was passed regarding the medical termination of pregnancy to uh, reduce the maternal and fetal death rate. What is the requirement of MTP? You know that whenever there is an unwanted pregnancy, they can go for the MTP. Okay, or in that case where the continuation of pregnancy is harmful to fetal and mother or both. So in that case, we can go for the MTPs. Now, this is also important. Uh, during the first trimester, they are the safest during the first trimester, but that can be done after the or during the second trimester, but this is risky. Now the thing is, a dangerous trend is occurring, and that is still occurring, that MTPs are performed by quacks. You know what quacks? Basically, they are unqualified doctors. It becomes fatal for mother.